As we know, the World Health Organization declared the COVID-19 outbreak as a public health emergency of international concern back in January. You talk in your note about the international health regulations. Can you just there are sort of questions arising, aren't there, as to whether the UK's handling of COVID before and after that declaration happened was appropriate. Can you just explain what the concerns might be in that regard?
Yes, absolutely. So the international health regulations date from 2005. They're a binding instrument as a matter of international law. They were adopted by the World Health Assembly, which is sort of the WHO's parliament, by more than 190 countries, including the UK. And they impose a number of mandatory obligations on states. And to pick out two in particular, firstly, states are under a duty to develop, strengthen, and maintain the capacity to respond promptly and effectively to public health risks, and in particular to these public health emergencies of international concern. And as you pointed out, that is a status or a label which the WHO Director General gives to public health risks on advice from an expert committee. And the second point is that states are also under a duty to base the implementation of any public health measures which they take on scientific principles and on the available scientific evidence. And they should look to the guidance and advice provided by the WHO. And now there are a number of questions regarding whether the UK's handling of COVID-19 was actually compliant with the international health regulations. You can look at the UK's preparedness in terms of adequate pandemic planning before. Were they adequately planning for such a respiratory virus pandemic? You can look at its capacity to respond to the outbreak from the start and as it developed. So that's availability of PPE, ventilators, hospital beds, medical staff, etc. But then you have to look at the early response. And in particular, prior to the first lockdown measures in late March 2020, did they do enough to effectively and promptly respond to the public health risk? And then you can look at the measures taken actually during the first wave. So just to give a few keywords, discharge of patients into care homes without testing, protection of patients from nosocomial infections in hospital settings and care homes, all these measures. And then you can look again, what happened in autumn 2020, how they reacted to the second wave, what is now known as the Alpha variant, whether that was done promptly and effectively. And again, I'm afraid right now, when you're looking at the spread of the Delta variant, are they responding in a prompt and effective manner? And did they develop and maintain the capacity to do so? And indeed, did they always base their measures on scientific principles or not?